Hello, my name is Corey Rutherford. This is my research presentation for course EDU 699. I'm a teacher of children with special needs in a level 3 classroom at Eagle Grove Community School District and have been there for 4 years. My study is titled Effects of Daily Classroom Exercise for Secondary Education Students with ADHD. Teachers of the 21st century are faced with a very difficult task. That difficult task is teaching a diverse set of learners requiring management of an array of fluctuating behaviors. Teachers now face these issues with additional responsibilities in and outside of the classroom. Declining school budgets and a lack of available resources. Often, these teachers face students that come from a vast range of homes and backgrounds. Students come from homes where disruptive behavior, aggression, lack of attention, and defiant behavior is a daily norm. Due to these behaviors, teachers are faced with the sad reality of challenging behaviors in the classroom that leads to an inability to create and proctor productive lessons and curriculum. For the learner, whether being distracted by behaviors of others or by being a learner that struggles with focusing, the challenges of tackling the material may seem insurmountable. It should be no surprise that one piece of this difficulty is getting the learner to focus enough to master the material. One of the most prolific diagnoses of children that display aforementioned behaviors is a child with ADHD. History. Attention deficit hyperactivity disorder is defined as a condition that affects children, adolescents, and adults. It is characterized by problems with attention, impulsivity, and hyperactivity. For example, a child with ADHD may constantly tap their foot or a pencil, which may indicate that their mind has wandered and they have an excess amount of energy that is preventing them from sitting still. In the past, students with ADHD were often stigmatized. These students were seen as fidgety and as disruptions to learning. Today, though, there is an overall drop in stigmatization of students with ADHD. Solution. Use exercise to mitigate behavior with individuals with ADHD. Hypothesis. Does periodic exercise decrease behavior in students with ADHD? Treatments. Currently employed evidence-based treatment for ADHD falls into two categories: pharmacological interventions and behavioral-based psychosocial treatment. Some effective treatments for curbing hyperactivity, impulsivity, and disruptive behaviors include pharmacological, non-stimulant, and stimulant medications. According to the Journal of Pediatric Psychology, psychosocial treatments, including parent management training and school-based contingency management, have also been proven effective. Although both pharmacological and psychosocial treatments are effective for a few individuals with ADHD, there are some who it will not be sufficient to control all behaviors. Physical activity studies. Bloomberg, Dickey, and Reddy suggest that physical exercise has powerful effects on the brain function and structure, and this is one avenue by which neural and cognitive development can be affected over both the short and long term. Reddy also states physical exercise can be defined many different ways, but is typically considered a physical movement by the body with the intentions of developing physical fitness or health. The main variables used in experimental exercise studies include intensity and duration. Some activities include repetitiveness, such as running and walking activities that incorporate cognitive skills. Purpose. The purpose of the study is to determine whether the use of periodic high and low intensity exercises can lessen symptoms, such as inattentiveness and restless behavior, in learning of ADHD students throughout the school day. It was hypothesized that low-intensity exercise prior to classroom work would lower the frequency of behaviors typical of children with ADHD. Birdman recounts the use of behaviors intervention systems and behavior contracts as a means of correcting minor symptoms of ADHD. Unfortunately, many of these symptoms are not adequately addressed. The perpetual recurrence of minor ADHD-type behavior, toe tapping, inattention, or restlessness, for example. Research gap. The researcher feels that the largest gap in the research is the lack of whole classroom involvement when implementing exercise-based interventions. It is thought that with whole classroom interventions, there will be a more improved level of involvement and acceptance. The working hypothesis is that Group B would display a decrease in inappropriate behavior throughout the 4 weeks of intervention, leading to an increase in productivity for teachers and students. Methods. This study was done in A-B design. The A group will be observed throughout a 4-week process with no interventions. The students' behavior and overall attention will be monitored and graphed based on the percentage of time they are focused when compared to the time they display inattention or an off-task behavior. During a 30-minute observation in a general education classroom, the researcher will note any off-task behavior for pre-selected ADHD students. Group B will be observed for the concluding 4 weeks. This group will also take place in a general education classroom. The group will be monitored for 30 minutes, also for similar off-task behaviors or lack of self-control after 3 to 5 minutes of low-intensity physical activity, such as jumping jacks, push-ups, or speed walking. Participants. The participants for this study include 7 9th through 12th grade special education students with attention deficit hyperactivity disorder who live in a small rural district located in north central Iowa. The high school used in the study has an enrollment of 230 students in grade 9 through 12. The materials that were used to progress monitor the participating students consisted of a list that was provided to teachers of low-intensity exercises that can be implemented prior to assigning classroom work, such as yoga, stretching, and walking. For example, a sheet was provided for in-seat yoga describing the proper procedure and duration of the exercise. Similarly, a walking path was suggested for duration and intensity of exercise. Sample stretching exercises were given with pictures and explanations for teachers to administer the exercise. Procedure. The research study began in the fall of 2016 school year. It was conducted over an 8-week period, ending in December 2016. The design of the study was AV style. The first phase of the study was 4 weeks. Students received no treatment but were monitored 30 minutes, 3 times a week for behaviors inherent to ADHD. This was the control group. The researcher gathered baseline data through daily monitoring of general education classroom while tracking behaviors per 30 minutes of the class time. Phase B. Starting at week 5, Phase B was implemented. Phase B involved implementing low-intensity exercises before students were expected to perform classroom work such as book work or coordinated group work. Participating students along with the entire class participated in low-intensity exercises in order to maintain anonymity of the test subjects. Exercises included calisthenic stretching, yoga, walking around the room, walking up and down stairs, walking through the hall, and running in place. During the B phase, behavior frequency was monitored throughout the 30 minutes of the class time. The data was collected daily in general education setting. The researcher averaged a score of the observed behaviors over the course of 1 week. This average was compared against the control group, which also had an average score of 1 week. Data was presented in a bar graph that compares the two groups week by week. Theoretical framework. It is theorized that Howard Gardner's 6 intelligence, interpersonal intelligence, can be affected by the use of exercise for better outcomes for those with ADHD. Interpersonal intelligence is described as the ability to understand and interact effectively with others. It involves effective verbal and nonverbal communication, the ability to note distinctions among others, sensitivity to the moods and temperaments of others, and the ability to entertain multiple perspectives. Children with ADHD display behaviors that are not typical of or appropriate when interacting with their peers and do not display adequate interpersonal skills. Results. This study examined the effect of low-intensity exercise on children with ADHD. The hypothesis was that low-intensity exercise prior to classroom work would lower the frequency of behaviors typical of children with ADHD. The independent variable in the study is the children with ADHD. The dependent variable, the effects of exercise, was not found to be significantly supported. P-value was 0.3. A phase, the first 4 weeks of data collecting was collected in the A phase of the experiment to set a baseline. The A phase mean for behaviors was 9.78 per 30 minutes. The standard deviation was 3.77. B phase, the next 4 weeks, or the B phase hypothesis was supported. It was found that the experimental class of students that completed exercise before coursework averaged less behaviors per 30 minute class period. Participants in the group that completed the exercise before coursework was averaged 9.28 behaviors per 30 minutes with a standard deviation of 4.35 with a p-value of 0.238. Discussion. The results show that behaviors were decreased by 0.5 behaviors per 30-minute class period. This number was found by subtracting the total number of behaviors during A phase from the total number of behaviors during B phase. Implications. As the research was being performed, the school district in which the research was performed showed interest in the outcome of the findings. Educators that experienced the effects of this study found that implementing the strategies into their weekly lessons would be practical and effective. Currently, my school district is looking for the best way to implement these strategies for all students without taking time away from instruction. I am currently using these strategies weekly in my classroom and have seen a great reduction in symptoms of ADHD. These strategies work very well with special needs students because you can modify each exercise to the need of each student. Limitations. Though the results are not significant, it can be said that these strategies worked. Throughout the study, there were students that did not respond well to the periodic exercise, and this caused more behaviors due to oppositional defiance. The researcher believes not allowing them to get an accurate interpretation of the effects of the exercises. Due to the complexities of ADHD, it is hard to quantify the severity of the effect of each child's disability and their individual responses to each exercise. It also needs to be considered that a student can react differently to very similar stimulus when similar reactions would be expected. According to Ellenberg, the effect of exercise on cognitive function can be masked by underlying behavior issues and the effect of immaturity in students with ADHD diagnosis. The results that were found closely resemble those of previous studies due to their success with individuals, but not when administered in a group setting. Another study by L.J. Hill, exercise was observed. Benefits occurred only for participants who exercised during the second week, which would be later in my B phase. It was determined that the test scores were adversely affected by age, sex, and level of ADHD symptoms. The research concluded that exercise interventions have a positive effect on cognitive performance. Suggestions for future research. The validity of this study was compromised due to the inability to fully determine the effect of exercise on cognitive processing due to the students with behaviors and other outside forces. If this study was attempted again, it would be treated as a pull-out program. Having students perform the exercise outside the classroom would benefit future studies because teachers would be able to see a more targeted effect on those being studied once integrated back into the classroom. It has also been suggested to lengthen the study to better understand the effect of each individual's disability. This would allow a more accurate determination of success preceding treatment. It is also felt that it would be beneficial to explore more options for exercise prior to academic work. Some of the exercises used can be problematic due to students not necessarily enjoying them. Due to this issue, it may be beneficial to take an individualistic approach to this research. After completing the study, the strategies that this researcher has displayed to their school district has continued to be implemented. Teachers at Eagle Grove Community School District feel that what this researcher has displayed has value regardless of the researcher's statistical findings. This is my works cited, and have a good day.